everybody, welcome back to my channel. So my name is Elizabeth. I am a labor and delivery and postpartum nurse and also a now mom to 3, including Miss Rosalie, who is almost 3 weeks old. Today I thought this video could be really helpful just to go over the things that will happen in the hospital with your newborn, things that you can kind of expect, the different tests and procedures that are typically performed, with the understanding, of course, that with like anything in birth, that you can decline things as they come up, but make sure that you've done good research and have figured out exactly what you want to do and have conversations with your pediatrician. So without further ado, let's go ahead and jump into it. Right, when your baby is born, it is pretty standard of care across the United States now for you to get some uninterrupted skin-to-skin time. Now this, typically we like to do about an hour, and what that means is that baby is going to be naked on your chest, under a blanket, and you ideally will not have anything on. If you've had on a bra when you're pushing or with delivery, or a shirt or a gown, we'll try and take that off, move that, and remove that to get baby skin to skin. This is going to do a multitude of things. So skin to skin helps your baby transition into extrauterine life, helps them maintain their temperature, have a good heart rate, decrease any stress hormones that are present, all of those good things. So having baby skin to skin is something that we like. And if you're breastfeeding, we like to let baby kind of initiate breastfeeding within that first hour or so. Now, a big thing to keep in mind when you are doing skin to skin is there aren't going to be as many known facts about your baby. We're not going to know the length of your baby or the weight of your baby while you're doing skin to skin, but waiting an hour or more to find out those things is totally fine because of all the benefits that skin to skin has. Now, if you don't want to do skin to skin, if you're feeling overwhelmed by that idea, if you have some past trauma, not wanting to have yourself exposed in that way, you definitely don't have to. You can have your partner do skin to skin, or you can just decline it altogether. But that is pretty standard of care, and you can also request that if it's not the standard of care in your area.
Hi, it's Future Editing Elizabeth here. I'm going to pop in a few times during this video. My apologies. But I wanted to touch on Apgar scoring, which is actually the first test that your newborn's going to get at 1 and 5 minutes of life. Apgar stands for appearance, or their skin color, pulse, grimace, are they crying, activity, what their muscle tone looks like, and respirations. And these 5 things get a scale of 0, 1, or 2, so you can get a total of 10. And at 1 and 5 minutes of life, we assess these things to kind of see how baby is transitioning into extrauterine life. So a score of 7 or above is a really good transition. Below 7, baby might need some resuscitation and continued Apgar monitoring until that number improves.
Another thing that is becoming more standard of care is delayed cord clamping. Now, typically 30 to 60 seconds is what is practiced in the hospital. So if you want longer than that, like 5 minutes or until the cord is done pulsating or whatever else, definitely just let your provider know. So something else that you're going to notice within the first few minutes to first hour of life is that your baby is going to get some sort of identification band put on it. Sometimes this is going to go on your baby's ankles or on their wrist or even on their umbilical stump cord clamp. There might be an identification band there, but it's going to be somewhere. There's going to be a number or a scanning mechanism so that they are matched with you if you're ever separated and then brought back together. And there's also going to be some sort of security device, more than likely, that will alarm if your baby goes off of the unit. We want to make sure that we are keeping the correct baby with the correct parents on the hospital unit until the time of discharge. So after that first hour of life, more than likely your baby will get a full head-to-toe assessment by your nurse or a nursery nurse. Hi, Future Editing Elizabeth here. I realized that I did not mention that with this head-to-toe assessment, which will be repeated with every single new nurse, your baby's also going to be getting vital signs, so respiratory rate, temperature, and heart rate. And we're going to be monitoring those fairly frequently because that's our best way of knowing if baby is transitioning well to extrauterine life. If there's an infection brewing, if there are any cardiac issues, if there are any sort of issues going on, those are going to be some signs that there are issues that we might notice during your hospital stay. For safety purposes, your nurse is also going to be checking on you guys every couple of hours to make sure baby is pink and warm and breathing as they are figuring out life in these first couple of days. And they will be doing you their measurements and their weight. Now, one thing that we are very concerned of with weight is weight loss. So all babies are going to lose weight after they're born. We just worry if they lose more than 10% of their birth weight. So typically babies are reweighed every 24 hours or so. The facility might do this based on the time of birth, or they might just do it, all the babies get reweighed at midnight. The thing that they'll do when they do their head to toe assessment, of course with your consent, is to give a couple of injections. So one of them is the vitamin K injection, and this is given to help populate your baby's body with vitamin K so that your baby can make the appropriate clotting factors that it needs. A lot of people are hesitant about this because they don't want to give a vaccine. It's not a vaccination. A lot of people want to give the oral version, but it's just not as effective. So in general, your baby has a low but a still present risk of having bleeding from the delivery, particularly if it was a delivery that required forceps or a vacuum, if it was a delivery that was particularly traumatic, if there's a lot of bruising. We can see bruising or bleeding around the brain, we can see bruising or bleeding in the gut. So that's what this vitamin K is going to take your risk almost down to zero with this vitamin K injection. So vitamin K is something I personally, as a labor nurse, try to provide a lot of education on. I think it's very, very important. And particularly if you are going to be doing like a circumcision, that is where we are creating a wound that could potentially bleed, you definitely want to be getting your vitamin K. The other medications that are given at birth or close to birth are the first hepatitis B vaccination. You kind of can start the series there. Some providers will have you start the series at your first appointment with the pediatrician, so that's not going to happen at every single facility. And then also erythromycin eye ointment, and that is really to help prevent any sort of blindness associated with an infection that is gotten through the birth canal. Most of the infections that cause this blindness that we have seen are chlamydia and gonorrhea. Then as far as testing goes, there are a few tests that are performed in the hospital to make sure that your baby is happy and healthy and safe, because some of these conditions, baby might come out looking really good, but then go on to have issues. So one screening test that we do is called a cardiac screen, and it screens for a whole host of cardiac disorders. And this is a really non-invasive screen. Basically, they put a pulse oximeter on the hand and on the foot, pre and post ductal, and make sure that those numbers match or they're very close together. If we have a big discrepancy, then we're going to need a further cardiac workup. So this is just a screen to make sure that the heart is functioning as it should. This is performed after 24 hours but before 48 hours. The next screen that will be done after 24 hours is a metabolic screen, and this is also known as the PKU because PKU is one of the disorders that it screens for. It also screens for hypothyroidism, like congenital hyperthyroidism. It also screens for different disorders related to the blood, like sickle cell, and a whole bunch of other disorders. I'm not going to list out all of them because I can't even pronounce all of them. But most of these disorders are things that if they're found early, they can be treated. If they're not found early, they can cause really significant issues. So that's why we do that metabolic screen, and that can be done after 24 hours. Now that is a little bit more invasive than the cardiac screen. It does require some blood. So we will prick your baby's foot and collect that. If that's being done at the bedside, you can breastfeed your baby while their foot is being pricked, or try and soothe them. You can let them suck on a clean finger during that procedure. And what we tend to do is kind of swaddle baby up really nicely with just that foot out. We'll warm that foot up with a heel warmer and then prick the outside edge of the foot to collect that blood. Now, at the same time as that screening, we might also screen their blood for bilirubin. So bilirubin is a waste product that your body makes as it breaks down red blood cells, and because of being a brand new baby, having an immature liver, and sometimes maybe having an incompatible blood type, we can see increased levels of bilirubin, which can lead to jaundice. And when jaundice levels get really, really high, they can cause kernicterus, which can cause brain damage, which is why we screen for it and we treat it well before it becomes really high with a Bili light or a Bili blanket, which is a blue light that helps break down those bilirubin into things that can be easily peed and pooed out by your baby. Some places will have a screening tool that screens through the skin, transcutaneous, and some will have a screening tool where you have to screen through the blood. Now, with the screening tool that screens through the skin, if it's elevated, then we will double check because the blood is going to be the most accurate thing. and that is typically done around the same time as the metabolic screening. The other thing that will be performed is a hearing screening. Basically what they do is they will look at the brain waves. It's not like with an adult where you can be like, I can hear that, I can hear that. So they'll look at what the brain waves are doing when listening to a certain sound, either with headphones or little earbuds on your baby. And so the hearing screens are often a little bit finicky because baby has to be really, really quiet, not sucking on a pacifier, not sucking on a finger, totally quiet and asleep to get it done. And sometimes with delivery, there can be extra amniotic fluid in the ears, so you might have baby not pass the hearing screen and get referred and need to go and see an audiologist after delivery. But that can be our first clue that there might be some hearing loss. Now, just because your baby does not pass the hearing screen does not mean that they cannot hear, but that just means that they need a little bit of further workup. Now, it might be the case that they can't hear, and it's really good to have that information early so that you can get proper interventions. Another thing that you're going to be keeping track of for your nurses, because this is how we keep track of how well baby is feeding and growing and taking in input, is we're going to be monitoring how long they're nursing, if their nursing's looking effective, swallows, all of those good things. Your nurse lactation consultant will probably want to see at least one feeding every shift, but then also what their output looks like. So we want you to kind of keep track of, are they peeing? Are they pooping? What does their poop look like? You don't need to save diapers more than likely, but just keeping a log or a record of these things, either written down or on your phone, are really beneficial. The first day of life, we expect one good feeding. The rest can be attempts, and that's totally fine, but we want to try to feed every 2 to 3 hours or more frequently based on what your baby wants. And what we expect for pees and poops, basically for the first week, you want a pee for every day of life that you're at. So first day of life, we want at least 1 pee. Third day of life, we want at least 3 pees, etc., until we get up to about 6 to 8 wet diapers a day is where we kind of want to be. And then for poops, it's about the same, so for the first 3 days. And then after that, we want to poop to 3 poops plus every single day for your baby, and that tells us that they're getting enough in and they're getting enough out, and they are doing fabulously. So your nurse is going to be asking you about feeds and about pees and poops. It's really great if you can keep track of that for us. The other things that you can do at your facility, if you would like, before you go home is a bath. So what we are finding out is delaying the bath by 12 to 24 hours is really best practice. It's going to let your baby transition into extrauterine life a little bit easier. It's also going to promote breastfeeding to delay the bath, and baby has all this wonderful cheesy vernix on them that we can kind of rub in. It's the world's best moisturizer. So delaying the bath is totally fine. Not having a bath in the hospital is also totally fine. If you want them to do submersion baths, you need to do that on the earlier end of things because the umbilical cord is going to start to dry up, and you cannot do a tub bath until that stump has fallen off. The other thing that you have a choice of doing if you have a baby boy in most hospitals in the United States is a circumcision. I'm not going to talk a ton about circumcision. If you know anything about me and about my channel, I'm not a fan of circumcision, but it's also not up to me to make decisions for your baby. So here's the information on circumcision that I want you to keep in mind if you plan on getting a circumcision for your son. 1, getting a circumcision is going to make your baby incredibly sleepy, so it's really good that you have had a first latch and that you ideally feed right before baby goes to get their circumcision, because they're typically sleeping for about 5 hours after the circumcision. You're also going to notice with the circumcision that it does require some care, that it is an open wound, and so your nurse will show you how to care for that, but it is not a very beautiful thing to see initially because there is some bleeding, there is some reddened skin that I just want you to keep in mind because it is a surgery that is occurring for your son. The other thing to keep in mind with the circumcision is that you just want to make sure, again, that they aren't getting a tub bath until that's totally healed, just like with the umbilical stump. It tends to be totally healed at around the same mark, so 10 to 14 days after delivery. The stump has fallen off, the circumcision is healed, and they can get tub baths. The other thing that you will do in the hospital with your baby before your baby goes home is start working on the birth certificate. So you're not going to get the actual birth certificate in the hospital, but what you will get is a proof of live birth form that you can use to get baby on your insurance. Okay, so I hope that that video was helpful, kind of going over everything to expect with your newborn in the hospital. I'm going to probably be doing one for postpartum as well, with a cesarean birth or with a vaginal birth, but I wanted to get this out because my next video is going to actually be with a neonatal nurse practitioner. We're going to go over what to expect at your first newborn appointment with your pediatrician. So definitely let me know if you have any questions. Was there anything else that you weren't expecting with the newborn that happened in the hospital? And until next time, bye guys!